Nadia Moore, Health Director for the City of Norwalk. Just want to do a quick roll call. We have Norman Weinberger, Board of Health member present. We have Terry Quell, Board of Health member present. Janet Karpiak, Board of Health member present, as well as Ken Laline, Board of Health member. We have Lamont Daniels, Chief of Community Services, Teresa Argandesi, Health Educator, and Megan Fogno, Project Coordinator from the Health Department. So good morning, everyone. Our first item on the agenda is approval of the October 27th, 2020 meeting minutes. Do we have a
I move.
motion? Thank you. Do we have a second?
Second.
I'll second.
Do we have any comments, revisions, discussion related to the minutes?
Yeah.
All in favor?
Aye.
Aye.
Opposed? Abstentions? All right, they pass. Thank you, everyone. The next item is public participation. Megan, do we have any attendees? Are they supposed to raise their hand if they would like to speak, or?
Shut.
Yeah, okay.
You're unmuted.
We have,
Good morning, everyone. I'm the only citizen that I guess understands how important morning meetings are. Diane Lauricella. First, on the record, I wanted to clarify a statement I made at the last meeting so that there is no, I don't know if it would be in your minutes, but I am here again to discuss the messaging that is still, would be still need to be enhanced about wearing masks and behaviors that would reduce COVID in our community. Last time on the record, I in a very frustrating manner stated that I had attempted to work with staff.
Thing has to do with the change in the.
Is someone else on the call? There's a. Okay.
Go ahead.
All righty. Anyway, I stated that because I had attempted for months to get action and to be reached out to as a citizen and as a citizen leader, it was very frustrating. It still is. But I said on the record that if no one will speak with me, and I pleaded for the Board of Health members to direct staff to have a discussion with me. So on the record, I did say last time that I know how to get the attention of the city if no one will speak with me. I want it clear for those that really know me and know me in the 34 years I've been a servant of my city, that what I meant was that I would go to the press. And it is insulting to think otherwise. However, that option is still open if it appears that the messaging that I think would help all of you in your pursuit of health does not happen. That is an option for anyone in the city, any citizen, anyone, including yourselves. I'd rather not do that. And so I will say that a few hours after the meeting, and I did feel very badly being so frustrated that I had to go on record last month. But within the day of the meeting, Health Director Dia Moore did call me. We had a discussion. And then later on, Teresa Argandesi and I spoke. But the problem is that the messaging that we discussed has still not occurred. And the clock is ticking, and we are still in the red zone in our city. So the fatigue and the depression that people have with isolation and this COVID problem is worse than ever because it's the holiday. And I'm sure, of course, you are all aware of that. I will just focus briefly on the following. There is two things that in the messaging, I believe, would reduce the case of COVID spreading as quickly. And that is the fact that exhalation valves that I still see around the city in supermarkets, on the street, indoors, is still being utilized. And I believe it's because the public does not know that with COVID, exhalation valves are not to be used, because people, if they are infected, will shed through the exhalation valve the virus. Now, finally, CDC has buried deeply within their mask references that exhalation valves may not be a good idea. And I cautioned the health director and Teresa that CDC, under the current regime in Washington, is being heavily censored. The fact that they waited until just this past month to talk about exhalation valves is because they are being censored. They are immorally withholding information from the public. But I expect better of my local Board of Health and staff and the city of Norwalk. And there are creative ways, no matter what you will discuss in a moment, to allow the public, using all the media possible. And we missed on using the tax bills. There are a lot of creative ways to get the information out, including the idea that I had early on in this COVID of having local citizens helping you all spread the news by being health ambassadors in the parks, in front of Stop and Shop and larger Stu Leonard's, and spreading the word on some of the more intricate details, but in layman's terms, about exhalation valves and neck gaiters and things that people are not doing. Now, the reason I'm saying this today is because people, of course, are interested in the vaccine, but most of us will not be getting that vaccine until the spring. And even then, as all of you know, it will take several weeks before the second dose is given. And in the meantime, people can be spreading this virus in whatever form it is in by next year. I again implore this Board of Health to make sure and support, but also make your staff hire extra people if necessary, to medical communicators that know how to put intricate and scary diseases in layman's terms to grab the attention of the public. It is still not happening. We still don't talk about aerosolizing enough. And what I'm sure you'll hear in a moment from the director, that most of the spread is in smaller household settings. Well, why don't we give the households a fighting chance of not spreading? It's just not rigorous enough. It's not a sense of urgency enough. And I expect better of you all. And now I'm including the Board of Health members, many of whom have expressed some interest in the fact that fatigue is happening. Under the reaccreditation, so I just ask you, be creative and let your staff be creative, but I just don't see it. I have seen some signs that are those signs that you put up when there's a road closure near the borders of Norwalk. That's not enough, and it's hardly enough. Is it creative? Yes, I guess so, but it's not going to get to the right people who are going to be sitting with their families this holiday season. I ask under scheduling that this Board of Health please look at transparency and meet in a time where the public will have access. Now, indeed, because of COVID, we do have access if people go online, but they don't even know that you're meeting. Can you please, before you finish your schedule for 2021, consider meeting in either late afternoon or early evening? I will help advertise that you are meeting to do your important work. There is no doubt that your work is very important, but I'm very concerned that not only is this Board of Health not transparent enough, but the public needs you now to help understand the emerging diseases and how to stay really safe from COVID? And lastly, because of what is happening with the issue of vaccines and people of color, I want to know today at the meeting, when you have your discussion, what special efforts will be made to make sure that people of color who had been experimented on with Tuskegee, et cetera, feel comfortable that the vaccine will help. And I'm sure you're going to address that. So thank you, and have a very happy and safe holiday. But please help us understand about exhalation valves, aerosols, neck gaiters, and safety of the vaccine. Thank you.
Thank you, Diane. Megan, are there any other attendees from the public? Okay.
No one else.
All right, thank you. All right. So the next item on the agenda is the director's report. Just wanted to give a couple of quick staff updates. We have our full-time public health nurse that started this past week. So she's being, onboarded and is ready to go. We also have our IAP outreach worker who started recently. So we have 2 new staff members that have been onboarded. And I also just wanted to give some updates related to the clinics. Charlene was unable to be on this morning because she's on another call, but we've been very busy with other clinical services. So we've been so focused on COVID, but I just wanted to let you guys know that our sexual health clinic has been very busy. We're doing appointment only. It's been going well, We have sessions twice a week, and we're looking to open a 3rd session now that Pauline, our new public health nurse, is on board to help support, additional services there. Thinking about creating a 3rd slot on Fridays for express visits, which would be those people that don't require exams. They just need some testing, or they have a standing order for treatment and they're coming, a partner, a contact of a case. So we're looking at that. But right now we're booking into January for appointments. And then we've also recently received quite a bit of referrals for latent TB treatment. So our staff have been busy with that as well. We did offer some additional flu clinics by appointment only after we had done the drive-through, after we had the staffing capacity and had that all figured out. And then we also are doing some routine adult immunizations. We've been booking those as well. So as we talk about COVID vaccination, it's in light of everything else that's going on, with the clinic. So as we focus on COVID, everything else is still going on, and it's been busy on that end. And then related to the clinics also, we're in the process of hiring for a medical technician to help support the clinics as well as the lab. Any questions related to any of that? All right. The next item on the agenda is COVID-19 updates. And so we figured we'll talk about obviously vaccination and messaging and quarantine enforcement and testing, but figured we'd start out with vaccination. So a lot has been changing, and moving, every day related to vaccination. So we now have 2 vaccines that have been approved that have the emergency use authorization from the FDA. And so we have the Pfizer and Moderna vaccine. The ACIP has recently given additional recommendations for the phases, but just to give like a general overview, included within phase 1A are the healthcare providers and staff, in healthcare settings. We have those that are in the long-term care facilities, so the staff and the residents of, nursing homes and assisted living facilities. And then the medical first responders, so like EMS, but then as well, like it could be fire and police who would respond to a medical call. So those are all those within phase 1A. Originally, health departments were going to be asked to help with vaccinating 1B, and we were going to be tasked with that critical workforce, which is being defined. The ACIP just met and talked about what would be under phase 1B, and they recommended persons age 75 years of age, as well as frontline essential workers. And so they've given some categories related to that, and it could include people, within the grocery store. It could include first responders. It could include, people in the education setting, teachers and staff. But originally the health departments were being asked if you can help with that critical workforce, later on in vaccination. But the state asked us to help out earlier on within 1A to help with those community healthcare providers. So the hospitals have received the Pfizer vaccine, and they've been vaccinating their own staff, and they're able to some are like scheduling appointments for other community healthcare providers. But that's a heavy lift for hospitals, and so they've onboarded other vaccinators. So they've looked to health departments and federally qualified health centers to also be part of this earlier phase. So we've been really busy working on. So we said yes. So there are 21 local health departments that the governor shared yesterday that are participating in this early phase right now, and we're one of them. We felt it was really important to participate in this and contribute to this, because there's a lot that needs to get done and a lot of people that need to be vaccinated in order to move on to those other phases. So we felt it was important. And also, this is what we do. We vaccinate. This is public health, and we're happy to be part of this and to contribute to this important effort. So related to that, we are anticipating receiving the vaccine soon and starting to vaccinate soon, but we're also in the process of learning the software system that it's called VAMS, that the CDC is using. So at the same time, we're figuring it all out, we're planning, we're going to make it happen, and we're learning a new IT system at the same time. And it's really important to us to make sure the experience is a good one for whoever comes to us, and we figure out exactly how to use the system. And Teresa and Megan have been really busy learning it. I don't know if you want to share anything related to that, but Megan's been looking at it from like a staff focus and volunteer focus. Whoever is going to be using the system, how do we get those? How do we make sure we understand it and then we can train others? But then also, Teresa's looking at it from an end user perspective. If you're one of those community healthcare providers who's going to be, or one of the, any like city employees that are part of that 1A, how does that process work, and how do they make sure we give them all the information they need? So Teresa, I don't know, what the manual you were looking at was like 25 pages long, and you're condensing it to shorter, smaller pages.
Yeah, so to their credit, VAMS has put out user manuals for each, individual who would utilize the system, anyone running a clinic, any employer who's uploading rosters, of people who would be eligible for phase 1A, and for the end user as well. So I was looking at the end user manual to see, if we can try to simplify some of the instructions especially for city employees who, we're going to be coordinating, a lot of their vaccinations. So yes, it was 26 pages, and I'm down to 3, but I don't have, screenshots or anything like that. So we'll definitely reference that manual. It's a great resource for folks that want to sift through the information. But for the people that want quick steps, I'm trying to bridge that gap.
Teresa, did you see that there was an all-day open Zoom call today from like 9 to 4 for this is for VAM training?
Yes.
Anybody that, if you got questions, send them in. Are you guys participating in that, or do you see a need for? I got some bunch of questions. Shoot them in the pipeline, if you would.
Yeah, when I saw that come out, I had a feeling Megan would be all over it. So what we're hearing is that just like most software systems, a lot of your questions will arise once you start using it regularly, right? So you can read the manual and you can imagine what it will be like, and then in the setting. So I think I give kudos to them for setting up that kind of a support system, because we hear that things will come up as you use it, and so it will be important to have immediate access to somebody who can answer questions.
And I really have to thank the state for that, for really wanting to support all of us who are going to be vaccinating, to offer that level of support. Even from looking at, the equipment that we'll need, like the barcode scanners, those, just to be able to share those resources throughout the state. They really want to help support us get this done. So they've had, several other of meetings where, Megan's been on a lot of them. I've been on some of them. Just it's good to hear other people's experiences too as they're learning it. So, you know, we can know what to look out for. So it really is a true community effort here.
And then finding those people that you can reach out to right away. So I'm making friends at DPH and making friends with local providers that are using the system so that we can call on them when we have questions. So it's been great.
So we're working on all those like logistical pieces and trying to, so we're ready to go so that not only can we vaccinate those within the city that fall under, you know, those phase 1A, but also for, you know, the larger community healthcare providers who are looking to get vaccinated. And so those who are, you know, their employer will upload their rosters, you know, for the healthcare providers. They'll be able to get a link to register, and they'll be able to see once we have clinics going, they'll be able to then schedule an appointment with us and come to us. Some of the logistical things we're working out is, you know, making sure like the spacing for all of this, right? So like there 15 minutes everyone has to wait after getting vaccinated. So making sure we keep people in a safe way for observation. So it's going to be like limited in the beginning to how many people we can vaccinate within a certain amount of time, just on spacing wise, needing to make sure everyone, you know, distanced and all of that. So those are like the small little, you know, those details that we're working on right now. We have our internal team that are working on some of those like details. Ken, I see you're unmuted. I don't know if you want to.
Yeah, do you have enough PPE? You got the
Yeah,
support?
Yep, we do.
Yeah, this is a monumental scheduling task, no question, because at the same time, we're still, you know, from the community health center point of view, statewide, we're still running an enormous number of testing sites on a daily basis. We're still the testing, you know, number of people that are testing positive is still, you know, it's not going down yet. You're right. I think it's going to be months. So the testing still has to be, and the messaging agreed that has to continue is that this isn't a cure till we hit what, 70, 80%. Then you can start working on other issues. But this is statewide that the state has been a good partner, but there's still lots of bumps in the road. So nothing's going down perfectly, but it's getting there.
Yeah. That's sort of the expectation with us too, is like, we want to vaccinate you, but you got to be patient with us too, as we learn this and you know, and it'll improve. We'll keep improving as we go, you know.
Don't forget, there's a lot we don't understand about the vaccine as well. We still don't know if it's going to prevent asymptomatic spread. That's a big question that hasn't been answered yet. So we may not be safe.
And it gets to, you know, what Ms. Loratello was saying earlier about we still have to wear our masks. We still have to, you know, there's all those important measures that we've been using. And I've been saying, you know, the vaccine is another really critical and important tool in the toolbox, but we still have to remember all those other tools that we have, you know, if we're going to get through this. We have to keep reinforcing those messages for sure. So, I mean, our hope is like, you know, while there's limited supply, you know, we're going to be doing these appointment only, working, you know, with the system, the processes that the state has established, and eventually get to the larger, you know, it's going to still be a while. So there's still phase 1A, then there's going to be 1B, and then there'll be 1C. It's many, many months of this. I can't wait for the weather to get nicer so we can do more outdoor stuff. We can, you know, it's easier to get more people drive through. But for now, we're focused on, you know, the healthcare providers and the rest that are in the 1A. Just to add, related to 1A, the nursing homes, assisted living facilities are being handled by pharmacies. They have contracts that so they already started last week on vaccinating those in nursing homes. So that's another big group in 1A. And so the mayor has established a COVID-19 vaccination task force to look at both logistics and communications and messaging related to vaccination. And so there's going to be a town hall meeting tonight on Zoom at 6:30. So welcome everyone to attend and to hear about. We're going to be giving an update to the community on vaccination and just our plans like moving forward. What the mayor is thinking and what our community partners and everyone is thinking and planning for related to vaccination, because it's both the like getting the vaccine in people's arms, like it's administering it, it's all the logistics, but it's also making creating that buy-in and messaging it so that all members of the community feel safe and want to be vaccinated and just have all the information that they need to make their decisions related to vaccination. Lamond, I know you're on. I don't know if there's anything you want to add related to the task force. Dr. Weinberger is on it as our Board of Health member. The mayor asked him to be on. So,
great. Good morning, everyone. Thank you, Deanna. I won't have video today, but also just to amplify Ms. Loricella's point, we are very sensitive to the historical context of vaccinations in our country. We've called it out, we put it front and center, and even during the town hall, we'll be talking about that and have relied on community stakeholders and groups within the city of Norwalk to help us think through what is the best messaging, and to also they themselves become those trusted voices to ensure that our community feel comfortable. While we know that at the end of the day, it's everyone's choice, we want to make sure that we do provide the most accurate and correct information to the extent possible, because the challenge is always is to compete with the inaccuracies and the propaganda that is often seems to be at the forefront of our media. So to your point, Ms. Loricella, we definitely will be addressing that. And then we'll be having these stakeholder meetings periodically. We had the initial one. The mayor has designed 2 work groups that Dan and I will be working with, and then Mr. Morgan from the communications for the mayor's office will be facilitating for us. And so we feel that we have a plan, but most certainly there is work to be done, and we're committed to doing that to ensure that Norwalkers have the right information. Thanks, Deanna.
Thank you, Lamond. Teresa, do you want to add anything related to communications? Because Teresa's going to be working with Josh in the mayor's office.
No, I mean, I think just to sum up what folks are saying, I think it's important to lay out the process for the public. So while we're addressing people who are hesitant or skeptical about vaccines, we also have a large proportion of people that really want their vaccine as soon as possible. So explaining that ACIP process of prioritization and how it works in Connecticut, but then also, so then looking at that, to Deanna's point about phase 1A vaccination, while communicating to everyone who falls into other phases about what will come in the future, and to Lamond's point, providing accurate, consistent messaging that addresses all of the concerns of the community. So I think we're looking at it in 2 different ways. We need to communicate what's happening right now, but also begin that, that wide public education and awareness, and keep people informed and be transparent throughout the process so that they understand every step of the way, how things are going to work for whatever phase we're in at the time.
Thank you, Teresa. And also just to add, like, continue to amplify the messaging, like we had mentioned, we'll talk about vaccination, but let's also keep talking about wearing your face covering and your mask and washing your hands and keeping your distance and, all of that. And all the information about testing as well.
That is so fun.
Anything else related to vaccination?
Where are the shipments that you guys will be getting coming through? Is it direct, depending on how many people register in VAM, or is it through the hospital? Or
So we put the order into the state health department, and they've arranged for the delivery. And so we're able to request a certain amount of doses, and our understanding is going to be like on a weekly basis. We can put an order in, and they may or may not be able to fill it depending on, the supply.
Right.
But we're working directly with the state health department, and they're arranging for the delivery to us.
Okay, thanks.
Yep. Anything else?
But to the general public, that would be depending on how many people are signing up to have that are in a category that is appropriate and have signed up through VAM, so that you would be proactively saying, hey, next week I've got 100 people that have signed up, and that's what your order would be. Is that how it's on a practical, on the ground basis?
In the future, we see it moving like that. Yeah, like what is the demand? But we also don't want to create slots for people if we don't have guaranteed vaccine too. So it's a bit of both of that, like, you know. So I'm trying to get an understanding right now. I want to, from the state, like how many people within our region are vaccinators right now in 1A, and how many people fall into 1A within our region, so we can have an understanding of how many are there out there right now who want to be vaccinated, and do we need to ramp up our capacity base to meet that need? You know, what is the demand out there? Because again, like we want to do our part, we want to contribute, and we want to keep going into the next phase so that the next group can get their vaccine. So that's something we're working on as well, and we're working with our regional partners on that too.
And obviously, it's really important that the general public understand this is a 2-dose event. You know, you're not done when you get your first shot. So.
Yep. And
so part of the functionality of the VAM system is so that it will auto populate like their next appointment. So it will send them an email saying you need to come back in for your next appointment. Please make an appointment. And then we're also, developing things in-house to give some, to pass to the recipients as they're leaving, just as a reminder card that it's a second dose. So we're trying to do it every, paper and email.
We have Pam Bates on our team already telling us, like, this is what you got to do in order to make sure that, they'll complete their series and all those tips. So it's been great.
Well, she's a good one to watch what she's done over time. She's done a great job.
Agreed.
So where is this 6:30 meeting tonight? Is that out in the newspapers this morning, and how's that being broadcast?
I know it's all on the social media. I know it's in the mayor's briefings. I haven't looked at the paper today, so I'm not sure if it's in there or not. But the mayor's office has been putting it on social media and pushing it out through their daily briefings that get sent to the press. Okay. Sure. So the next thing I wanted to talk about was just testing. So I don't know if you've seen on the city's website, there is a page that is dedicated to testing. So it lists all the upcoming testing events, like the pop-up testing for COVID-19. So Semaphore we've been working closely with the governor's office on creating additional testing opportunities in Norwalk. And so Semaphore has been able to bring up some additional pop-up testing in addition to Community Health Centers Inc., which is at Vets Park. So there's a web page, and I can that's on the city's website that is there you can find out like where the previous testing and then the future testing providers. So we continue Lamond and the mayor's office, and we all continue to work on ensuring there's testing within the city. And
amazing as the shift in even just what we've just addressed here. We spent 90% of the time today on vaccination. About a month ago, it was 90% of our time was spent on testing. So it's evolving. So, but testing is going to be with us for a long time. So.
Yeah, and bring back to your point, Ken, earlier about the community health centers, like very qualified community health centers there. They've been doing so much of the lifting with the testing, and now they're going to be doing a lot of lifting with the vaccination too. So and that's another reason why we want to make sure we're doing our part with vaccination, because we know the federally qualified health centers have been doing a lot. Okay, quarantine. So recently the CDC has updated some of their information related to quarantine, that they still recommend the 14-day quarantine, but there are some different options for folks to allow to be out of quarantine earlier than the 14 days. And the state health department recently released guidance related to that. And so there's the 10-day, Teresa can explain this better than I can probably. It's 10 days with no, you can be released out of quarantine if it's been 10 days past your last contact and you're symptom free. Or it could be 7 days if you've tested negative, and you can test negative at day 5 with a rapid with an antigen or with a PCR. And so we've been going through all of that information, looking through it. Teresa, I don't know if you want to say anything related to the quarantine, but it's still like nothing has changed in terms of there's still a risk later on to still becoming sick. So I think we get that question a lot, like, well, have you realized that, that it's a shorter quarantine period, a shorter incubation period? And so the incubation period hasn't changed at all. It's still 2 to 14 days.
Yeah, so it's a communication challenge just because it's several layers of complexity compared to a straightforward 14-day recommendation. But the CDC and the state have suggested that it would be helpful for folks who wouldn't be able to be compliant to the 14-day recommendation. So people who are asymptomatic and are really struggling to be home because of lost wages or other hardship. And so that's, really what we're working on now is finding a way to effectively and efficiently communicate that, and working, closely with the contact tracing team, because they're the ones who will be, reaching close contacts directly and giving them that instruction, but also a way to explain it to the general public. And so the main takeaways are, like Deanna said, the incubation period hasn't changed. So the CDC still believes that the 14-day quarantine is ideal, but is offering these alternatives for people who, for hardship or other reason aren't able to quarantine for the full 14 days. And so also important to clarify with people is that if they are leaving quarantine early because they're asymptomatic, they have to take special precautions between the time that they end their quarantine and the end of the ideal 14-day period. So there's a lot of information to pack into a message for folks who are close contacts or quarantining. And so we're just working through the best way to do that, not to confuse people, and to be as clear as possible about those. It's a little bit easier when you're a contact tracer. I mean, not easier, but it's a little bit easier when you're speaking to someone one-on-one and can answer their questions and can talk through the complexity. But when you're trying to create materials for wide distribution, it's a little bit harder. So we're working through that right now.
Thanks, Teresa. And then I just wanted to share that the state is working on enforcement and creating some like standard processes and like sort of like tips and tools for all like the health departments and the municipal officials that are doing the enforcement of the reopen guidelines, creating some standardization and some best practices. And so I've been participating in a work group at the state related to enforcement. And so that work also continues. And we get complaints every once in a while, and we respond to them. We work with the police department. So that work is also continuing. So to Ken's point, the testing and has been a big focus, and enforcement has been a big focus, and now we have vaccination, and we have messaging. And so all of these things, we're just kind of adding more and more as we go, and we're continuing to need to do that work. Does anybody have anything they want to add related to COVID? All right. Megan, can you give us an update at reaccreditation?
Yes, good morning. So there's been some changes at FAB. And so they recently, in their latest newsletter, just updated folks. So the process for things have changed. the major things related to reaccreditation is there's a new template for extensions. So if we would want another extension or need another one, there's a formal form now to request that and kind of explain, you know, the situations. I had a call with our accreditation specialist last week, and she just really emphasized how FAB is really, you know, understands that what's going on with local health and, you know, public health, and they want to be there as a supportive role, and they're looking to help us in any way we can, especially since we're in the midst of our accreditation, reaccreditation process. So whatever they can do for us to support us, they're willing to do. And so they made a few different changes that would affect our current process. So during the pre-site visit review, FAB, the accreditation specialists now review all of our documents, and they reopen and leave comments. And then it would be passed on to our peer site visitors. So the change they made is if a measure was met, but maybe just missing one of the elements. So for an example, it was A through D, and it was maybe just missing the element B. Now they're considering that as met with missing, and when it would go to the FAB review board, it would show as met. So not really missing. It would say met but missing, and it would be counted in the whole grading system, which they don't have a grading system, they tell you, as met. And then it would just be in the comment section of the final report what that element was missing. For us, that's kind of a good thing. So related to all the measures that we had to reopen, more than half of them are in that category where they're just missing that one little element. And so our accreditation specialist told us to really just focus on the pieces that weren't maybe met but missing something, to really focus on those other ones. And these measures, if we were able to get to them and we wanted to address them, we could go ahead and do that. But if not, we could leave them like that, and they would just be met with missing, and the comments would just be added to the report. So that really takes a weight lifted off our shoulders, and we could then really hone in and focus on the other elements that that were reopened. So for staff time, we could really prioritize, you know, which measures staff can be working on. And so moving forward, we're going to look at those. There, of course, those smaller ones were like the low-hanging fruit that I already started to ding off just so I could check it off that it was done. So if we do have some of those met already, I'll you know, review those. But the other ones, we're probably going to move forward and maybe you know, see which ones we could really focus on just to prioritize staff time. And I'm trying to think if there was anything else. That was like the big thing, the big takeaway on our call. And so I guess we'll update the board and the next few months to come. If we do ask for an extension just because of COVID vaccine, you know, coming out and rolling that out, we may want some more time just to, you know, dedicate to some of these measures. Deanna, is there anything else?
No, thank you, Megan. Any questions related to reaccreditation?
Up to good work. It's not an easy thing to do, keep that accreditation, but I think it's important considering we were such a lead position nationally that keeping our ranks in line is a good thing. It's a good thing. So.
There was one more thing I forgot. The even bigger than the whole met versus met with missing is that FAB is now allowing you to upload new documentation. So it used to be that the day you submit it, any additional documentation that you wanted to submit later or to replace other measures, it had to be from that date or prior. Now they're allowing new documentation. So prior to this newest revision, it would be anything COVID related you could use as a new example. Now it's including COVID related and any other related work that we're doing. So, I mean, we're doing great work around COVID, but there was also other things that we had thought like, oh, this would be a great example if we could use for FAB. So now we can use some of those documents as well. So Deanna was really happy to hear that because there was some documents that we were thinking of using that now we can use.
Thank you, Megan. All right, the last item on the agenda is our meeting schedule. So let's talk about for starting in January, like when we want to meet. Do we want to look at evening, afternoon hours? What's everyone's schedules like?
The morning seems to be working pretty well.
I agree. Morning works pretty well.
Ken, Janet, what do you think?
Mornings work best for me. I can't do an afternoon. You know, in the evenings, it's competing with a lot of other meetings.
That's the issue. Morning is best. It's the clearest in many calendars with the time frame that we currently do. I certainly appreciate the other issues that are out there. We're trying to make sure that we can meet as often as we can at the right time.
Morning or afternoon is good for me. Evenings is pretty hard, but I'm, you know, whatever the group wants to do is okay with me.
So I'm hearing from everyone morning really is for everybody really the only option, right?
What you might want to do is if there's issues that need to be addressed on an ad hoc basis, I don't think that I would be, and we're meeting once a month. If you had said to us, hey, anybody can, and do a quick search, anybody can hit its meeting at a different time. For this time, we want to address specific issues that need to be addressed. Instead of having a full blown meeting, you can have an update that is, you're looking for input or passing along information where we can adjust that. I would be open to having an ad hoc meeting once in a while to make sure that we close the loop on issues that are of real high importance. I don't know, how does everybody else, and I don't want to speak for anybody else on that.
No, I think that's an excellent idea. I think that if you need an update, put out who can meet at such and such a time. And I think a lot of people, this is a very workable group, and people who can do that will do that.
Okay.
I also want to be respectful of the staff time, and I know some folks like to meet in the evening, but you folks, I want to commend the staff. You all are working 150% evenings, weekends, and to start doing evening meetings on top of everything else you're doing, I'm not sure that's really fair to the staff.
Agreed.
I agree as well. I think the staff is doing a great job in disseminating all information. I'm getting a lot of great information. I know in speaking to a lot of my fellow Norwalkers, they as well have agreed that information is being disseminated very well. And I appreciate everything, the hard work that the health department in Norwalk is doing.
You're here.
Right, so we're thinking about like our standing meetings in the mornings, but periodically throughout the year, we can have some like late afternoon or like evening meetings. Okay, all right. How about day of the week? I know, Janet, Tuesdays used to be good for you, but then I think your days switch.
Yeah, I'm now Wednesday off, but I can, as long as I don't have to round at the hospital with babies. If it's one baby, I can deal with it before 8, but if I get a few of them, I won't, it throws things off. So it's workable as long, if it's 8. If you're making it later, then Wednesdays are a better day for me.
Okay.
I have no babies, so I'm fine whenever.
So we want to keep 8 o'clock then?
Yeah.
Do we want to do Tuesdays or do we want to do Wednesdays?
Whatever day works for anybody, I'm sociable.
Agreed.
Yeah, pick the day that works the best for the staff.
Okay. Yeah, I think it doesn't really matter for me. It could be any day.
All right, well, let's stick with Tuesday then. We're all used to that.
Yeah. And you guys have scheduled around, your work schedules around that already at the And so it just it works well. Let's stick with it for now.
Okay. All right. Thank you, everyone.
Thank you.
Thank you.
Thank you. Great job, everybody.
Thank
Hope you
you.
have peaceful holidays.
Happy
Here,
holidays.
here.
everyone.
Happy
you.
holidays.
Happy
Wear a
holidays.
mask. Wear a mask
Everyone.
Yes.
Man. And stay home.
and stay home.
Yes.
You know,